3, 2. And welcome back, everyone, to Singularity University's Exponential Medicine. We're at the Real Ears podcast right now, and I am your host, Kevin Edwards. Alongside me today, we have Jennifer Goldsack, the Executive Director at Digital Medicine Society.
That's exactly right. I'm thrilled to be here. Thanks for having me.
Well, thanks for being here, Jennifer. So, what is Digital Medicine Society doing at Exponential Medicine, and why are you specifically here?
So exponential medicine is amazing in terms of it really is at the cutting edge of different scientific approaches to improving health and healthcare. And that's really aligned with our vision at the Digital Medicine Society. And what we recognize is that there's a whole new digital era that's finally arrived in healthcare. But as with any new technology, right, it can be a weapon or a tool. How can we make sure that these digital tools are helping bridge health disparities, right, are providing more accessible, affordable care to everyone and aren't widening disparities across the digital divide, for example? How can we make sure that we're actually using digital tools and big data in the way that we can sort of process huge amounts of data to deliver, to save lives we couldn't before, right, to deliver targeted care, and that we aren't just doubling down and creating a surveillance economy. This is a really important juncture in the introduction of digital to healthcare, and we're here to try and be stewards as a professional society to make sure that it's used for help, not for harm.
Oh my gosh, Jennifer, I'm so glad you brought that up. And I'm so glad an organization like
And we
this,
didn't even pregame on this.
No, we didn't. I'm so glad you brought this up, and that your organization is taking this on, because the digital divide is something I really like to talk about. Okay. Maybe could you explain to our audience who are unaware what the digital divide is and how Digital Medical Society is bridging the gap?
Absolutely. So there's a couple of ways I think we can describe the digital divide. Sure. We talk about the proliferation of smartphones, for example, right? But what gets lost is what about that percentage of people who don't have them, who are still using a flip phone? There are people who in their professional jobs every day use technology and are very comfortable with it, right? But what about people who work in a different kind of job and never have access to that, didn't go to university, didn't have access to tools, right? As we start to develop offerings that target only people who are comfortable with technology, right? Who are we leaving behind? And then I think the last and most important piece is, for anyone who has a cable plan and Wi-Fi at home, it's not cheap. And actually there are huge parts of America that actually don't have broadband at all, right? So when we talk about delivering these things and we talk about extending healthcare offerings, we think about using these tools as engaging people, the really important question is, who are we leaving behind? And how do we think about using the opportunity to take care and health management out of the clinic into a more available and affordable setting, but not omitting this really important part of our population who in some cases are also vulnerable for other reasons.
Jennifer, there's no silver bullet to solve this digital divide. It's very, very complex.
Yep.
Is it an education issue to adopt this issue? Is it a cost issue in terms of maybe like an MRI scan is too expensive to go into these locations? What have you learned through your experiences, and how are you maybe tackling some of these issues?
So I think what we're trying to do at the moment, well, let me pause for a second. Sure. There's something that's really important, which is, there are massive disparities in health and healthcare right now. And what I don't want to do is hold up, and what the society doesn't want to do, is we don't want to hold up progress with digital by holding it to a higher standard, right? We don't want to say, because it's not completely equitable today, we're not going to move forward. But I also think we have to be really intentional about how we develop a new field and how can we make our best effort to bring folks with us. And I think that as well as not always taking, and perhaps going to be unfair, but I'm going to say the easy pathway, right? And say, well, though we already have this population of users who have access to the internet, who have access to smartphone, we're going to target them only, right? How can product folks and investors and developers really think about tools like using SMS systems that just require a flip phone, for example, to engage people? How can we think about maybe providing a data plan along with the tool, because you know what, that's still cheaper than bringing someone into the hospital, right? How can we think about making things like broadband widely available as part of, moving the whole of our country a little bit further forward? I think those things are really important indeed. And then also potentially even thinking about developing digital tools that intentionally target current healthcare disparities. So for example, there's massive maldistribution of specialist physicians and folks who need their help. There's a really neat digital tool that's come out, IDXDR, and what it does is it uses a smartphone, it does a retina scan, and it helps people with diabetes see if they're at risk of diabetic retinopathy, right? Doesn't need a health professional, it just needs a tech. And what it does is if they're at risk, then they can be connected with an expert. And if they don't, then they can just be monitored by someone in whatever setting they are, whatever their neighborhood is, whether it's rural or urban, high or low resource. Really, really good use of collective resource, but also something that could feasibly be available to everyone. And that's really important.
And that's exactly what you just said is what we've been learning from these previous conversations. For instance, with this, Dr. David Albert was able to bring in an ECG scanner that you can have on your phone, and millions of data points now. And AI coming in, all these emerging technologies. But answer this question: if blank doesn't happen, then technology will not evolve. So what needs to happen in order for technology and progress to evolve and really change to have an impact on the world?
So I think technology is going to progress no matter what. I think it's what's the impact. Is it going to, and I go back to what sounds very dramatic, but I really believe it. Is it going to be a weapon or is it going to be a tool in healthcare, right? And I think the most important piece right now that we're not thinking about is this question of data governance, right? How many times have you downloaded an app and not read the terms and conditions? I don't think I ever have.
I've never have
right?
Either.
So you start to download these, health apps or whatever they are, and they can, people have access to data and information about you, and that then goes on to a third party. There's huge troves of data. They become available to different actors, and now let's say we can build an algorithm for agitation based on wearable sensor data, right? Because you might move differently in an agitated state. What does that tell us about you? What presuppositions do we now have about you as a person? How does that affect your ability to get health insurance, life insurance, get a job, right? So I really think as we get more and more health information about individuals through sensor data, through data from place like GPS, for example, we really need to have much better data governance to allow to, one, protect individuals, but two, also make that information available to good actors, to researchers, right? To people who actually want to conduct outreach plans. And I think that we are way behind on our progress to make data available safely and protect individuals from sort of nefarious actors.
That seems to be the common theme with tech evolving. And to maybe fill in the blank, I would say data governance and trust amongst the consumer.
That was a good succinct fill in the blank. Thank you. Better than I did.
Might be the linchpin in terms of accelerating that technology. Because you're right, the horse has already left the barn. Is technology going to evolve or not? It continually has, it continually will.
Absolutely.
But what about the adoption part of that? I think is an interesting conversation.
And then the impact. Is it going to fulfill its promise, right? In improving health, improving healthcare, improving health economics, right, which is also huge, or is it actually going to be? Is it actually going to hurt particular subpopulations even more than current state?
Right. And rightfully so, right? Because in terms of the trustworthy part, because technology has created the digital divide. It has taken away a lot of cultural diversity. A lot of areas around the world now are increasingly becoming the same and having the same businesses, and now there's less culture. You go to the same area, kids are playing the same video games, they're talking about the same things. It's having this untalked about impact on our society. And so in such a world that's now connected, we're also more disconnected than ever. So back to your point, you said, is it a bullet or is it
a weapon or a tool?
A weapon or a tool. I think that's an interesting discussion. How do you monitor something like that, and what are you most excited about in the future?
So I'm most excited that we actually build an intentional use of digital medicine tools to help people. And I think the intentionality is absolutely critical, because I don't think it's going to happen by accident. We have a lot of data that says actually if we just let things go on, right, you get Cambridge Analytica and you get other sorts of nonsense around technology. So that's what I'm really excited about, knowing that we have veterans every day who are committing suicide because we can't help with their PTSD, right? We have people across America who are rationing their insulin because they're a diabetic and they can't afford it. That current state is unacceptable. And I believe that digital tools can actually help with that, but we need to make sure we do it intentionally and that that's our focus and that we are not blinkered to the risks, and that's a really important part of the society, and that's why when we talk about the community of digital medicine, it's not, air quotes, sort of just clinicians and tech folks, right? It's also ethicists, it's also patients, it's also white hat hackers, right? To make sure that data is safe and secure. It's government, it's payers. Everyone needs to be at the table to build that intentional future, and that's what we're trying to do at the Digital Medicine Society.
I like that a lot. I was going to say the way I describe social impact or social enterprises are companies that, as they scale, they intentionally solve inherent environmental or social problem.
Yep.
Sounds like Digital Medical Society is one of those. Where does this come from, and have you found that that mission, that purpose, manifests throughout all your members and employees as well?
It absolutely does. So we're still really new. We launched only in May of this year. We have phenomenal support, including from FDA, the European medicines agencies, government, payers, as well as all of the other experts that I mentioned previously. I won't sort of list them again. The energy is coming from the community. We have sort of overperformed in terms of number of members. We've got over 700 across 24 different countries. And we've done all of this work. We've done publications, position papers, blogs, educational sessions, and all of it comes from member engagement. We don't have a fancy science writer. The work is coming from people volunteering to be part of the community, sharing their knowledge, collaborating. And that, I feel quite strongly actually, is what I'm most proud of, because I keep repeating it, but we are building it together, this new field, and we're building it intentionally.
So how can people get involved in Digital Medical Society?
So I hope that for anyone this message sort of resonates with, join us. It's very low bar. It's either a free membership or just I think like a $50 donation if you want to. And dimesociety.org is where you can find information about membership. And then as soon as you sign up, you're sort of automatically integrated into this amazing, interdisciplinary, thriving community. So we do hope that folks will join.
Incredible. Well, Jen, thank you so much for coming on the show today. It's been a pleasure speaking with you. And if there's one last point we want to make,
okay.
There's never been a more important time to be a leader in this space, whether you want to be, help or hurt society as technology evolves. So, Jen, the last question we have for you today is, what is your definition of a real leader?
It's a hard question. I think it's any individual who's not afraid to take a position that's really important to them and pursue it and bring as many other individuals with them, even if that means at some personal cost. And I don't think that means a leader has to suffer, right? But you have to go above and beyond, I think, to be a leader who really is going to affect change, whether that's to bring other people with you, to lead other people with you in pursuit of that goal that you've defined as really important to you.
Well said. We talked about a lot today, Jen. We talked about the Digital Medical Society, how it's addressing some of the world's greatest challenges. The digital divide was thrown in there today. We talked about, so what decisions basically are you going to make today that's going to have an impact on the world going forward? Learned a lot today. I think it's really interesting to see how technology is evolving, especially in the medical space. And then lastly, we wrapped it up with your definition of a real leader. Jen, thank you so much for coming on. For Jennifer Goldsack, I'm Kevin Edwards, asking you all to go out there, maybe take a little personal cost if you want to be a real leader. And always, folks, keep it real. Thanks, Jen.
Thanks so much. Really enjoyed it.